Elite Health Online. My name is Clay, co-owner of Elite Health Online, and today we have Amy Spear, one of our lead nurse practitioners. Welcome, Amy. Thanks for being
Hi,
here.
how are you?
Excellent. Well, Amy, today we're going to be talking about a couple of different things, and obviously to our audience, none of these things are meant to diagnose or treat patients. This is educational only, but in treating thousands of patients for low T, I know you hear something that I hear frequently, and it is around depression. That many men come to us, a lot of women also, claiming that their doctor's been trying to diagnose them with depression for years. They're experiencing different things related to low T, but continues to be pushed on them that maybe it's depression. I've even heard patients who tell doctors, "I'm not depressed. I'm not myself." And I just had this conversation this last week, and had a patient who had some feedback around how amazing he feels now, but wanted you as the nurse practitioner to share your experience and what you see on a daily, weekly kind of basis around this area, and give us your thoughts and maybe what people might be experiencing or what their doctor told them and what exactly Elite Health Online can do for them.
So I actually had a patient today who said that he had a lot of issues with feeling down, just lack of drive, all the symptoms that you're talking about.
Hmm.
And his doctor did offer him an antidepressant, and he convinced him to try testosterone instead, and all of his symptoms went away. So there have been a lot of studies showing that just along the lines of getting older and having lower testosterone, the other symptoms seem to manifest like
Right.
depression. And some studies show that the treatment with testosterone does improve those symptoms. Some of them don't, but there has been some improvement with that for sure.
Right. I had a friend this weekend that I was with, and he was telling me that literally he was seeing a church counselor for, depression and help, and he was at the end of his rope, and he's gone back and now shared his experience with testosterone. Antidepressants weren't
Mhm.
working, counseling. He was saying, "Look, you gave me 10 things to do. I'm doing all those things. There's still something not right." And after going on testosterone, those things cleared up. So I know you've seen that. Are
Yeah.
there a particular order in which you think these things ought to be attempted and tried?
A particular order,
Yeah,
meaning,
meaning someone's questioning, is it low T, is it depression, or is it both?
well, I think it's always good to check their levels and see, where they are. And then sometimes if it's borderline, you can always do a trial of testosterone on a lower dose and just see if it improves their symptoms, or even boost their testosterone production with maybe HCG or kisspeptin at this point, and see if that helps as well.
Yeah, excellent. And in your experience of treating, I know we've treated thousands of patients here at Elite Health Online, and a lot of them fall into this category or did at one point. How fast traditionally do they experience the change with
With
your
testosterone, usually about 4 cycles, so 4 injections,
mhm.
they'll notice some improvement one way or the other. But they have to do lifestyle changes too. So they can't be eating junky food and not exercising and things like that. This is supposed to work in conjunction with lifestyle.
Yep, definitely. So again, most of our patients that we see, and most of those folks probably listening, are probably doing a lot of those things, and they're at the end of the rope now and ready to try medication. What if someone's already on an antidepressant? Questions whether that's really needed. They're now on testosterone therapy or considering that and trying to come off of an antidepressant. What's the proper steps to take?
So I always recommend doing it with the help of their physician. But generally speaking, when they want to wean it off, then they need to just start gradually lowering the dose over a period of several weeks
Okay,
in order to do
excellent.
that safely.
Excellent. Well, thanks for sharing today, Amy. If you're one of those folks that's suffering from depression or feels like maybe that's it, maybe a doctor's put a label on it, you're not 100% sure that's it, look us up at elitehealthonline.com. There you can order a lab panel and schedule a visit with one of our providers. We'll go over your symptomology, go over your lab work, and get you set up on the right program to see if we can get you on the road to better health. We've certainly seen it in plenty of patients in the past, and would love the chance to help you. Thank you, Amy. I appreciate your time today.
Thank you.